Frankly, the best practices intervention in the Asian Middle East region is, I would say, it's the backbone of this project.
Healthy women are more likely to have healthy children, well-nourished children, well-educated children. Healthy women are more likely to save and be productive in their communities.
We have gone where nobody wanted to go. We have given services to people that have never received services.
We are taking the lead for scaling up family planning, maternal, neonatal, and child health best practices in the Asia Middle East region to contribute to reduction in mortalities and improved health.
Dan ini merupakan satu model pelatihan yang sangat baik sekali, memberikan hasil yang cukup mengesankan untuk menurunkan angka kematian ibu dan bayi.
We are on the right track to the achievement of MDGs, and especially with the MDG 4 regarding neonate and MDG 5. And best practices is one of our intervention in this aim.
And I'm looking forward to a fruitful 5 days that will help all of you introduce and scale up best practices in your respective countries.
We started in 2007 with a technical meeting in Bangkok where we invited 13 country teams. We exposed the 13 country teams to state-of-the-art best practices, and we assisted them in developing action plans for scaling up in their countries. We awarded grants to local entities, and we provided technical assistance to those entities to help them implement best practices.
And very important, the use of scientific scale-up methodologies in some countries like the Improvement Collaboratives process.
Improvement Collaborative, what is it? We need to establish the Improvement Collaborative.
The Improvement Collaborative approach depends on several teams from the same country working on one technical intervention and sharing the same approach for data collection and proving that their intervention worked. The core of it is to develop quality improvement teams.
Sekarang saya sangat membantu sekali ya. Saya jadi mengerti tentang bagaimana membuat suatu program, kemudian dimulai dari membentuk struktur organisasinya dulu, kemudian rapat koordinasi, kemudian menjalankan program dan akhirnya evaluasi dan monitoring.
60% of the mortality is caused by emergency situation. So this is why we focus on emergency care.
Problem adalah bahwa sebagian besar masyarakat berada pada satu sosial ekonomi yang rendah, kesulitan transportasi untuk datang ke sini, pengambilan keputusan rujukan yang sering terlambat, sehingga kita seringkali kebanyakan pasien datang dalam keadaan yang berat.
Kami mempunyai bayi yang kelahirannya cukup banyak, 500 sampai 600 per bulan, dan angka yang kesakitan cukup tinggi. Waktu itu kami memang belum sistematis pelayanannya. Semuanya kami pisahkan, hanya banyak bayi yang sakit sama yang sehat saja tanpa diklasifikasi. Tapi sesudah dengan Ponek kami belajar mengklasifikasi menurut derajat penyakit dan menurut golongan bayinya.
JNPK approached us with a proposal from the Ministry of Health to improve this situation and reduce maternal and neonatal mortality. The program is a hospital-based program. They are improving the quality of the emergency obstetric care and emergency neonatal care.
We choose Tangerang because they have very high MMR. It's about 600 per 100,000 live birth. And also Tangerang have good enough human resources, equipment, and also support from the local government. We do the training for the providers and standardize them how to use the best practices.
Paket Ponek untuk disebarkan ke rumah sakit Ponex, rumah sakit seperti Cilegon atau Serang yang secara horizontal, kemudian secara ke bawah ke puskesmas Ponet yang sudah dibentuk.
We can improve our services here because we can do more training, more improvement of the services, more improvement of the tools we have here.
We also train health center and community midwife in monthly basis.
Salah satu saja yang saya ceritakan, saya baru habis menangani pasien dengan preeklamsi berat yang datang ke sini. Lalu saya lakukan dengan pemberian standar MGSO4 dengan anti-hipertensi. Setelah kami dari tim Ponek ini menilai bahwa dia bisa lahir per pagi 6, akhirnya kami lakukan induksi persalinan dan alhamdulillah pasien dalam keadaan selamat, bayi dan ibu juga selamat.
In our demonstration hospital, Tangiran, in less than 1 year, the maternal mortality was cut by 66%. Neonatal mortality was cut by 50%.
Yang kita perbaiki dalam berbagai aspek adalah yang pertama tentu standar pelayanan mediknya. Yang berikutnya adalah pada hal-hal yang terkait dengan pencegahan infeksi. Kemudian fasilitas untuk penanganan kasus emergensinya sendiri, equipment yang berkait dengan penanganan emergensi.
Dari segi tenaga, pengetahuan kami tentu bertambah, baik itu dari dokter anak maupun dari staf perawat, sehingga kami bisa merawat bayi lebih baik.
Nah, saya dari itu klinik mau disuruh ke sini, katanya lahir nggak boleh ngedan, harus disesar.
Bayinya sekarang bagaimana?
Belum ngeliat saya.
Belum ya. Dulu kami dengan dulu kami belum mempunyai keahlian di dalam bidang komprehensif. Jadi hanya sedikit yang kami punya. Tapi setelah saya dilatih Ponek dari JNPK, kami sudah mampu menangani kasus-kasus yang memang datang ke kami dengan berbagai macam problem.
هذا النتيجة الوفيات العالية هذه هي ناتجة من نسبة الخصوبة العالية الموجودة في اليمن.
There are many factors affecting the health of women: social, economic, gender, cultural, and geographical and demographic distribution of the population in Yemen. Even the religious background of these women about reproductive health and family planning, because still they have the bad interpretation of the religious rule in the especially in reproductive health and family planning. we need really the support of religious leaders with us in this, but more especially in the reproductive health issues. As we said, these are of the health issues which are very sensitive among the community as its relation to the religion.
علاقتنا بمشروع الخدمات الصحية الأساسية علاقة عمل. نحن نقوم بالتوعية وإرشاد الناس ومشروع الخدمات الصحية الأساسية يقدم خدماته، فيلتقي التوعية مع تقديم الخدمات في وقت واحد.
The stars were aligned. We had the Ministry of Health, we had the USAID mission, we had the providers themselves and their hospitals, and we have our own project. All of these were kind of really enthusiastic about the best practices.
We started the best practices in a Sab'in hospital, and it was really a model for other hospitals to start with.
The rationale that we adopted in introducing the best practices in Yemen was to start with a major teaching hospital, which is used not only by the people in the capital, but by people coming from all over the country. And this is a Sab'in hospital.
الحقيقة أفضل الممارسات ساعدتنا كثير، وفي نفس الوقت أدت لنا معرفة، عرفتنا بحاجات كثيرة ما كناش نعرفها، وفي نفس الوقت هذا الدعم كله يعني زي ما تقولي رجع للأم وطفلها. الفائدة الأكبر للأم والطفل، لأن إحنا بدأنا الآن زي ما تقولي.
We have 8 best practices. Some of them relate to emergency obstetric care, including neonatal resuscitation, active management of third stage of labor, and the reduction of infection in the neonatal nursery as well as in the delivery room. We have others that relate to postpartum family planning, exclusive breastfeeding, kangaroo mother care for low birth infants, vitamin A supplementation, the immunization of neonates for polio and BCG.
الصفرة هذه هي مفيدة للطفل، تمام، لأنه بيدي لها الوقاية من الأمراض.
Before, we had women come into the hospital, deliver in whatever conditions, and leave within 2 hours.
هذا لما تشربيه يوصل له عن طريق الرضاعة. الرضاعة تكون من أول ما يولد الجاه.
Thanks to the implementation of best practices, we have introduced systematic counseling.
تمام.
كان لنا كحول عندنا قبل من أول بعد شهر من الولادة بعد 40 يوم. أيوه. تحب لك حب بعد الولادة مباشرة. فبيخرجين الأمهات والحمد لله أولاً توعية من داخل من الولادة من بنات الولادة وبعدين توعية من عندي من هنا. فبتخرج الأم فاهمة عن الرضاعة الطبيعية وفوائدها.
So this is our chance to give them counseling about family planning as well as a method, and to also give them a referral advice on where to get additional contraceptives.
From a Sab'in hospital, we took the idea how to spread it to other governorates. We spread it to main hospitals in different governorates.
When we trained our Sab'in hospital staff, we also started training trainers from other important hospitals and other governorates that are likely to introduce also the best practices in the second phase. And all these hospitals have a relationship with health centers and with rural hospitals, which are the next level. Lahaj Hospital, which is one of the hospitals that is featured in the implementation of best practices, is located in a region that has a very dynamic director of health.
من الولادات اللي تحصل عندنا هي ولادة غير مرغوب فيها، بمعنى unwanted pregnancy ناتج لعدم availability، عدم وجود وسيلة من وسائل تنظيم الأسرة التي تحتاجها الأم حتى ايش تستخدمها، فهذه المشكلة الأساسية.
لا الحمد لله في وعي كبير مع الأزواج، خاصة إذا دخل الزوج وعده شوي متعلم الحمد لله بيتقبل الوسيلة. إنما زي ما تقولي يشتوي شوية صبر وشوية إقناع، فمع الإقناع ومع الصبر ومع هذا تفهمي تقولي لا أصبح يعني وضعنا الحمد لله الاقتصادي صعب، هو بعدين يتقبل الوسيلة وفي نفس الوقت يرتاحوا يخرجوا من عندي مقتنعين الحمد لله. ما فيش إنسان خارج من هنا مش مقتنع.
In Yemen, the family planning counseling in the postpartum period and the vitamin A provision to women in the postpartum rose from 0 to more than 70%. Immediate breastfeeding rose from 0 to 85%. Women were not receiving any contraception before leaving the hospital after they deliver. Now, 10% of women leave the hospital with a contraceptive method in hand, which is amazing.
And we find really the health facility is more, we can say, women-friendly.
The fact that I attended Bangkok with the country team, the fact that ESD was there to help with the follow-up by saying, let's have a plan and let's have an implementation of the best practices that you select, this was very, very useful for us.
For a very small investment, we have been able to touch the lives of millions of people.
Only about 32% of hospital doing the best practices. And ESD and JNPK try to increase that up to the level of 90%. Without any assistance from donors such ESD, we cannot do it by ourselves.
The successes were enormous. However, we still feel that there's more room for supporting those countries before those best practices become sustainable in their own systems.
All of this work is focused on the underserved because the best practices are really dedicated to serving the needs of the underserved.
Saya mengharapkan untuk kemajuan ke depan karena semua personal dari Kamar Bersihin RSU Tangerang belum dilatih ponek yang diberikan oleh JNPK pada kami. Saya mengharap untuk kedepannya semua person dari RSU Tangerang ini untuk di Kamar Bersalin sudah semua terlatih, diberikan pelatihan ponek oleh JNPK sehingga kami semua sudah siap untuk apapun yang akan kami hadapi nanti ke depan, sehingga pelayanan bisa sesuai dengan standar dan seperti yang kita inginkan, yaitu membuat ibu dan bayi jadi sehat dan selamat.